Hey everyone, my name's Lavonne and welcome back to my YouTube channel. Years ago, I made a little video, this was early YouTube days, all about vaginal exams. Many of you have probably seen that video. So today I'm back because I have upgraded my life and my film equipment and all of my birthy supplies here. And so I wanna talk all about your cervix, vaginal exams, and then I've gone through your comments on that video and looked at the questions that you've had based on the response to that video. So I'm gonna answer a bunch of your questions here for an updated version all about vaginal exams. I hope you find this super helpful, but before I get into it, make sure you subscribe down below, give it a like, share it with a friend, and then let's get going. One of the questions that I got on that previous video was, at what point does my provider, meaning a doctor, a nurse, or a midwife, check your cervix? And what does that even mean? So as a review, if you haven't seen that video before, at some point in your pregnancy, usually beyond 37 weeks gestation, which is like 3 weeks before your due date, unless your doctor or your midwife thinks that you could be in preterm labor, somebody may ask you, and the key is ask you for consent to check your cervix. What that means is inside your body, you have your uterus, and your uterus when you're pregnant is filling up your abdomen. It's getting nice and big. It goes all the way up to your ribs. That's why you're like short of breath at times. And then at the bottom of the uterus is the cervix. If you go back to my What is Labor video, it's my very first video, and it was like done on my iPhone, and it's somewhat embarrassing to watch, but also has really good information. That I talk about the cervix being the plug keeping your baby inside. And so throughout labor, really labor by definition is when your cervix changes with contractions, meaning it starts to dilate or open up and then thins out. So you can watch those videos, I'll link them down below so you can learn more about that. But the idea with a vaginal exam is we're not actually checking the vagina hole, okay? They're checking inside the vagina, which the vagina is about, let's say like 4-ish inches, okay, about the length of my fingers. And let me just very clearly disclaim that I am not checking cervixes with these nails, so don't get concerned that your provider will have much shorter, much more appealing nails for your vagina rather than me up in there with long nails. So your cervix is at the base of the uterus, it's inside of you. And so what needs to happen at some point, ideally in your labor, probably, or even prior to labor, your provider will reach inside. Let's say your vaginal hole's here, they reach inside and they reach the cervix. And that exam is gonna give us some information about where you're at in labor. The only way to know where you're at in your labor process, whether or not you're actually in labor, is by checking you. So one of the very common questions that I got on that previous video was, can I refuse, or do they have to check you? Okay. This is, once again, I feel like I'm gonna reference this video in every single video from now on because I need you to watch your rights as a patient video. I will also link that down below because you need to understand that everything that happens to you is your decision. It should be presented that way. It's not always presented that way, so you can, of course, refuse. But a vaginal exam, especially from my nursing perspective, can give us an idea where we're at in the process. Are you actually in labor? Is your body starting to change? And your cervix can begin to soften and to dilate prior to you actually being in labor. But the only way to know where we're at in the process is by checking you. Even an ultrasound isn't as good, okay? So if we were to check you, and let's go back to the beginning. Let's say you're not in labor. Let's pretend that we're checking my cervix. We are likely going to see a closed cervix. And this exam, if you look closely, there's like a little divot in it, meaning there's no hole through to anything, all right? So really what you would imagine is if you're reaching up my vagina, looking up towards the base of the uterus or the end of the vagina. Your vagina ends, okay? It's not like an infinite abyss into the land of your entire body in there, all right? Eventually you'll hit the end, and that end is your cervix. In general, I'm not gonna recommend you going in and feeling around in your cervix, but I will also say that it's your body. So whatever you wanna do to explore down there, I am not opposed to that either. I may or may not have checked my own cervix, and I can feel a little divot inside, okay? That's what you want to feel. Now, anytime that anyone touches your vagina or there's anything inside the vagina, you may experience a little bit of vaginal bleeding, especially if you're pregnant. So anytime they do an exam, You might see that because the cervix is super vascular, meaning there's tons of little blood vessels that go there. It's also why in labor you may see some bloody show or some mucousy vaginal bleeding because that cervix is likely dilating. And then as you go through labor or as your body begins to change and the baby comes down and puts pressure onto the cervix, which it really would be this side because the baby's head is coming down, putting pressure on the cervix. So really they can't come through, or even like you think about having sex, like nothing's getting through if your cervix is closed, right? So this is kind of blocking the way. Now, as labor goes on, you may begin to dilate a little bit. So now we have our 1 centimeter cervix. And with a 1 centimeter cervix, your provider would reach inside and they'd be able to fit like 1 finger into a hole. So if maybe you're a nurse and you're watching this, what we're looking for is a hole or an opening of the cervix. Now, what I want to point out here, and I showed this in the first video, but is a baby going to fit through that hole? Never, right? Like look at the size of the baby's head compared to this hole. There's no way that baby's gonna fit through. And so that's one of the reasons why if you come to the hospital and they send you home at 1 centimeter, you really don't have much to be concerned about. Now, could you move quickly? Yes, flex and flow. But in general, you're definitely not in active labor. This would be considered early labor, and you can walk around at 1, 2, 3, 4 centimeters sometimes for weeks, all right? If we look at the definition of labor, we need regular cervical change, meaning thinning and dilating or opening up over time with contractions. If you have contractions without, that's just considered Braxton Hicks. So that's our 1 centimeter cervix. Then as we begin to dilate a little bit more, we see a 2 centimeter cervix. So if I'm reaching inside, I'm gonna feel for the edges of the cervix here, right? And then I'm gonna see how many fingers I can smush inside, right? Sometimes you can get like 1.5 fingers, that's about a 1.5 dilated cervix, but if I can shove tightly 2 fingers inside the cervix, we're talking about 2 centimeters, okay? So that 2 centimeters, still early labor. Great news, we're moving in the right direction. We're not quite in active labor yet, but you can see the cervix is beginning to dilate. The other thing I wanna point out is the effacement or the thickness of the cervix. So if you're looking up the vagina like this, okay, I'm feeling not only here, but I'm also feeling how thick it is on the sides this way. This I would say is about a 50% effaced cervix, maybe 60 based on the thickness. But so it's not just the dilation, it's also the effacement. But for now, in this case, with what you can see with these models, we're mostly talking about dilation. Then we get to our 3 centimeter cervix. You can see it's a little bit wider. If I'm your nurse or your doctor, I can fit my fingers comfortably inside, and I'm really feeling on the outside of my fingers, and they can spread apart a little bit. Still early labor, but we're getting closer. Then we get to our 4 centimeter cervix. And 4 centimeters historically used to be active labor, but then when we looked at the studies, we realized that labor takes way longer than we thought. And so early labor is considered up till 6 centimeters dilation. But if we reach inside and we can feel this much of either the water bag or your baby's head, this is good news. You are getting so much closer. Usually at about 4 centimeters, things also sort of begin to pick up. You might be wanting to go to the hospital at this point. You may be wanting to get an epidural potentially at this point, okay? And the goal would be that you don't arrive to the hospital before about 4 to 6 centimeters is what I tell people, because sometimes 4 centimeters can be really uncomfortable for people. And so you're gonna weigh that pain versus suffering. You can watch my epidural or not video on that one. Moral of the story is this is what a 4 centimeter cervix looks like, and it's starting to, I can separate my fingers inside. 5 centimeters looks a little bit wider, and then I'll compare that to 5 to 6, because 5 and 6 centimeters, for me as a nurse, especially if they were watching this as a nurse, is probably to me the most tricky to determine. And so how I distinguish between the two inside is that the 6 centimeter mark is like me being like, hey, yo, peace, what's up? Where I'm like taking a picture, I'm like, yay, here we are, 6 centimeters. So if you ever see that in anything that we do, it's sort of a labor and delivery inside joke of like 6 centimeters, woohoo, we're celebrating because this is active labor. And I'm like kind of spreading my fingers wide. Versus a 5 centimeter is just a little bit in from that. So I'm saying my fingers are spread wide. We're getting closer to a like solid fingers wide. That's more of a 6 centimeter mark to determine between the two, but they're really, really hard to figure out between the two because there's such subtle differences, which goes to show one of the questions that I get asked all the time is, should I check my own cervix? Can I check my own cervix? Can my partner check my cervix? And I'm gonna say, you can do whatever you want. It's your body. There is risk of introducing bacteria to where the baby is and risk of infection. And so that's why we wear sterile gloves when we go in there. And so if you were to, make sure you wash your hands super well prior and make sure you get under your nails and stuff. You also can break the water bag, which we don't want to happen. And that's why your provider is being really careful of that and sort of gauging based on feel. I will say if the water bag breaks by them like barely touching you, it was probably about ready to break, but it can happen. And then the other thing is when you're checking yourself or you're having your provider check you, honestly, this took me so many tries to be able to figure out. And even to this day, like there is a little bit of discrepancy between providers that my 6, that's like a solid fingers wide, might be somebody else's this, which for me would be more like a 5. So a 5 to 6, we wanna know, moral of the story, it doesn't have to be super duper exact because we know that you're changing. So a 1 versus a 5 is a very different exam. If you have an experienced examiner, you're gonna know the difference between that. But the difference between a 4 to a 5 or a 5 to a 6, flex and flow, there can be a little bit of discrepancy. That's okay. We sort of expect that because it's not a perfect exam inside. So we've made it to 6 centimeters. I think this is 5. This is 6 centimeters, and notice you can start to see these little ridges on the top of what would be the fetal head, right? And let's say that there's no water bag, the water's broken, because normally there might be like a smooth surface between, that's the water bag that goes between the baby's head and the cervix. This way, all right? So in this case, we don't see a water bag, we just see actual suture lines and then what we call a fontanelle. So if you're a nurse, once again, then inside, when they're in there, they may feel around for what this really is the back of the baby's head to know what position the baby's in. If you've seen my back labor videos or my OP or my sunny side up labor videos, I have a 3-part series on that, talks about the position of the baby and where the baby's facing. And based on a vaginal exam, we can somewhat reliably, I say somewhat because it's not the most exact measurement, but we can get an idea of what way the baby's facing so that your nurse or your care team can help you to rotate that baby, okay? So we wanna feel to make sure that that line is down the middle, not off to the side, which means the baby's head is crooked like this, and that they can start to feel a fontanelle because that means the baby's head is tucked. Some of this might be a little bit technical. This is what I teach nurses. This is what I'm so passionate about. So I hope that if you have any other labor and delivery nurse friends that you would send this video to them because I know this will probably be very helpful to them, especially if they're new. And if not, you get the insider scoop on what we're feeling for. But all of this takes so much work. Thousands of vaginal exams. I swear I've seen over 5,000 births and I've probably checked like 10,000 cervixes at different points. Sometimes I'm checking them multiple times in labor based on what's happening. So it takes a lot of practice. No need to do it on yourself unless you're like, oh, the baby's coming and you reach down and like, oh, there's a head, like get in the car and go to the hospital. Then we get to our 6, we're at 6, so now we're 7 centimeters dilated. Now look at how much of this head, this light part is the baby's head coming down. That means there's like very little holding back the baby. This is when labor is super intense. We are in active labor now. We are moving towards transition, and this cervix is really stretched. You may see some bloody show, and on exam, if I'm inside, I'm really stretching my fingers to start to be able to feel for how wide that cervix is, until we get to about 8 to 9 centimeters. And by exam, like if I were to actually do this, honestly, this is probably 9 centimeters, but when I go inside, I feel differently. I actually feel from the edge to know what kind of cervix is left over. So if you look here, there still is that light colored cervix all the way around, but there's very little cervix holding it back. So at this point, you may feel pushy, obviously, because look, the head is actually coming into the vagina a little bit more. Hopefully it's coming into the vagina, right? And imagine this is the top of the baby's head, so we're like aligning like this. And so as the contractions happen, you may feel the urge to push. Your provider may actually, especially if you've had a baby before, if you're feeling that urge, they may kind of help and push the cervix out of the way, and then to help bring the cervix totally gone, because when you reach inside and all you feel is head all the way around, that means you're technically 10 centimeters, and then it's time to push. Some common questions I've had all about vaginal exams would be, when do they start checking you? This is gonna be entirely provider specific. So a lot of times I would say probably, if we're gonna generalize in a big way here, doctors may check you after 37 weeks, maybe towards the 38 to 39 week mark, because they like to have that information to kind of know, are we starting to dilate? And if you are, you may be closer to labor and birth versus if you're totally closed. Whereas I would say on the midwife side, a lot of times they're a lot more hands off with you, so they may never check you until you're in labor or even towards the end of labor. The other big concern that I hear all the time is that you've gone to your provider's appointment, they've checked your cervix, and they've told you that you're totally closed, or you're 1 centimeter, or you've been contracting all week and there's nothing happening with your cervix. And then I get DMs, or I get comments on YouTube videos, or I even get emails or stuff on my website of like, oh my gosh, I'm freaking out, I'm 39 weeks or I'm 41 weeks and there's nothing happening to my cervix. I want to be very clear here that just because in this moment nothing's happening to your cervix, in hours it could change. So really, any dilation prior to labor, unless you're having regular painful contractions, any dilation, hear me out, is a bonus. It is extra credit from your body. We are celebrating that change. And does it happen a lot of times that you sort of start out 1 centimeter or soft before labor? Yeah, that can happen, but it's not expected. The definition of labor is cervical change with contractions. If you're not contracting and your cervix isn't changing, you're not in labor. So why would we expect you to be dilated, 2-3 centimeters before you actually are in labor? So if you're not in labor especially, we are not concerned about a closed cervix. Obviously, do we want more? Yes, but you could change within minutes. So take a deep breath. Please don't stress about this stuff, guys. This can change at any point. Your water could break in this moment. You could all of a sudden start having painful contractions. 6 hours from now, you could be having your baby. That's how quick things can happen. Probably not for a first-time mom, maybe second, third, fourth-time mom, yes. But first-time mom, we're expecting that within about 24 hours, you're probably in active labor. Take my childbirth class for that. I have labor prep, medical interventions, where we talk all about this stuff so you can really learn. But please don't stress about it. They will use lubricant when they check you. If they don't, please ask. I had a question on my previous video on that, and I'm like, they should use lubricant to lubricate it up. But another big concern of yours is, or the question is, why are cervical exams so painful? Couple of thoughts here. One is that when you're not in labor, if the cervix is really high inside of you, as the baby comes down, it sort of like pushes the cervix down with it as the baby engages. And watch my Engage the Baby video for more information on that and how to get your baby engaged to help maybe stimulate labor. But if you're not in labor, then we sort of expect the cervix to be harder to reach. So if I go inside and let's say, I don't know if you'll be able to tell this, okay? Let's say your vagina starts here, okay? And the cervix is right there. It's right straight inside. I'm gonna reach inside and I'm gonna have to reach and go, oh, okay, I feel closed cervix. I'm done. That's how long it takes. Versus if the baby hasn't come down and your cervix is all the way back here, or it can be faced one direction or the other, I may need to go inside and then really push to try to reach it, and then reach up behind and pull it down so that I can reach it directly on. That can make the exam a little more uncomfortable. The good news is that as labor continues or progresses, that things should likely get a little bit easier to manage. The vag exam can be like, I'm in, hold on, and I'm done. That's it. That's how long it takes, unless it's a little harder to reach. So your provider may have you sit on your hands if that feels uncomfortable to you or restraining to you. You can ask to roll up a towel under your butt, or maybe put a bedpan under your butt, because once you tip your pelvis forward, instead of it facing backwards with your cervix facing this way, instead you tuck your hips and all of a sudden it brings that cervix forward so that we can check a little bit easier. So that's a side tip. You can even do that if you're that maybe you haven't had contractions, they want to check you. Just sit on your hands if you feel comfortable, or ask for a towel to be rolled up under your butt. And then the other thing is etiquette, cervical exam etiquette. So if you are a medical provider, I want to remind you that these pregnant people are likely nervous. They maybe know you a little bit. They maybe have met you, especially if you're a nurse, and you're a stranger putting your fingers inside of their vagina. That's a very intimate thing. And so as medical providers, we need to be extra aware of being extra sensitive to giving entire control over their body, to asking for permission before we check them, to saying, okay, I'm ready to check you. Would it be okay if I checked you? This is why we would love to know what's happening with your cervix. When they say yes, I usually give them a warning by touching their inner thigh. Prior to inserting my fingers, I tell them everything going on. I'm not staring at their vagina the whole time. Once my fingers are inside and I know where I'm going, I'm like looking off to the side, maybe like telling them what I'm feeling, okay, helping them breathe through it, telling them, even what I find too is helpful is that if I'm having a hard time checking the cervix or I'm saying it's really high, I'll tell them that's what I feel. Because otherwise they're sitting there like, what's happening? Why is it taking so long? Why is this so painful? Why is she pressing her hand so hard? And before I have to like reach further to get to the cervix, I'll usually be like, okay, take a deep breath. I can't quite reach it. I need to push a little bit harder inside to grab it. I think I can grab it, and then we'll be able to know and I'll be done. Is that okay? And they'll be like, yeah, great. And then they know what's going on versus the unknown can feel so much more overwhelming and so much more uncomfortable. The other thing is approach. When we're just up there, that is like, whoa, invasive in my vagina, okay? Take a deep breath. The other thing is if you're a patient to say prior to the cervical exam and be like, hey, I'm okay with you checking if you are, but I would love to be warned what's happened. I would love to tell you when I'm ready versus like sheet back, hand in, whoa, what just happened? And you feel a little violated in that moment, right? And so I would like to tell you what's happening, and then when or if I say stop or no, I would love it if you would respect my stop or no and make a very clear limit, because a lot of times for us, to be honest, we're used to vaginal exams sometimes being painful. We're used to labor being painful. And so somebody saying ow, ow, ow may not trigger your medical professional to stop and remove their hand. You need to be very clear that stop means remove your hand or take your hand out, I'm done, right? Versus ow, 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 okay? That's just sometimes an easy miscommunication that can happen during vaginal exams that can be really uncomfortable, and you can feel like they didn't listen to me when really we're so kind of used to things being painful in labor, and so it may not compute in their mind to stop in that moment, all right? So make a no, and then if they continue, especially if you're a nurse, you can look to the nurse and say, I'm saying no. I'm saying stop. And I will say from experience that if you say it like that, I'm going to, as a medical professional, I'm going to be like, whoa, oh, my hand's out, right? And they may want to go back in and check you, but you still have full autonomy over your body. I feel like vaginal exams can be a very sensitive thing, especially if you have any history, that it can be really uncomfortable for you. And so in order to set yourself up, it's really important that you have clear communication with your care team about what your expectations are, that no means no, stop means stop. And then the other thing is that just having that lubrication, taking some deep breaths through, knowing that it's short and sweet, we're done super quickly. And the more you resist and pull back and like, and lift your butt up or run up the bed or even tighten those pelvic floor muscles or your vagina muscles super tight, it's gonna be more painful for you. So this is great labor breathing practice to just take a big deep breath in, blow it away, keep going, focus on your breath, and know that we're talking 10 to 15, maybe 20 seconds max. If it takes too long, you say stop, you need a break, ask for that break. Your provider or your team should respect that. And if they don't, that's a whole nother video. Let me know if you want that one in the comment box down below. And then ultimately you make it through, and then you know, am I close to delivery, or should I really go home and continue laboring at home and trust and set myself up for coping and for relaxing so that you can get to eventually this baby out and in your arms, fully dilated, able to push, and hopefully having a really positive birth experience along the way. Thanks everyone for being with me here today. I hope you found this extra helpful. I hope this built upon your knowledge of vaginal exams or labor. If there were things in here that you were like, huh? I was talking about a lot of little summaries from previous videos, so make sure you subscribe down below so you never miss a future video, and then scroll through because I have different playlists for different things so you can learn so much and walk into your labor and birth totally confident and ready for that experience versus fearful. And I see all the time that the less knowledge, which is why I'm so glad you're here, the less knowledge and the less support can lead to a poorer outcome or even a traumatic experience. And that's not what I want from you. I want you totally ready and confident, which is is why I have multiple childbirth classes on my website that you can check out on demand for the rest of your life. You can watch them for all your babies. And that's a childbirth education class with a childbirth bundle. There's a coping with labor class to help you kind of get through some of this stuff, including contractions. There's a VBAC class. There's an infant safety and CPR class. So make sure you head on over. I'll link everything down in the description box to check out those classes, get yourself educated and confident. And I would love to walk alongside of you as you continue to learn and get ready and anticipate this sweet baby being born. If you have any other comments, questions, concerns, throw them in the comment box down below. And then make sure you follow me on Instagram because there's more stuff happening over there. And then until next time, don't forget to flex and flow, and I will see you soon. Bye. I gotta get in a mood. Get in a mood. Please don't roll. Please don't roll. Vagina. Okay. Hey. Vaginas!
What?
Yes!
Oh my gosh.
Okay. Hey everyone, my name's Sarah Lavonne, and welcome back to my
Sucking it the whole time, hey guys.
This lip gloss tastes disgusting. Ding, 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 ding. I should know my intro song by now. I've heard it like. I feel like these pants are kind of slimming.
They are.
Like, waist. We have a waist. We have a waist. We all have a waist. Okay. I got nothing.